Karli was going to school and working both at the time of her accident. So she was a busy girl. She was on the go all the time. She loved being with friends. She loved to just go places. She loved music. She loved traveling. Just a very happy-go-lucky girl. This was on a Friday. I had gone to work and had a normal day at work. Everything was fine. I came home just like normal and went to bed, and then I was awakened by the phone somewhere around 1:30 or 2 in the morning. The worst call of my life.
Some of the initial providers on scene indicated that she was critically ill, so they were actually working on what we call a rapid extrication. So they were in the process of removing her from the vehicle, getting her to the stretcher. Since it was kind of one of the colder months, our first obligation with her was to get her to the medic unit to try and control the environment. We immediately knew that she was critically ill. She had a low Glasgow coma scale, which was 4, which means she's not responding to us. She had a very unique irregular breathing pattern called Shane Stokes breathing, where she would breathe, take some deep breaths, and then she would actually quit breathing for a period of time. We really wanted to do just a couple things to stabilize the immediate life threats, which was try and take control of her breathing, warm her up, and get her to the trauma center as soon as possible.
My initial reaction was disbelief. I was speaking with the nurse in the ER, and she did her best to calm me down and kind of try to at least tell me what had happened and what was going on at that particular time, that Karli had been in a bad accident and had a very bad head injury, and she did not want me to drive to get to the ER, so she sent out a Lincoln policeman to pick me up and take me to Bryan West.
Karli was a Category 1 activation. That requires multiple team members that respond. So the trauma team leader, the nursing staff, that then puts the CT scanner on hold, which also then allows the OR to be on hold and her to be able to go to the operating room very quickly if that was what was needed. And calling Dr. Hawkins, the neurosurgeon, immediately once we knew what the assessment was and what the CT scan results showed.
So the subdural hematoma was the primary injury, or the life-threatening injury for Karli. On the way to the hospital, she had a change in her exam that was a decline, and so the decision was made that because it was a very recent change and she was very young, that we would go emergently to evacuate that hematoma, take the pressure off of the brain, and allow her a chance.
I don't really recall how lengthy the surgery was, but of course for me it felt like an eternity before Dr. Hawkins came out to visit with me.
What made Karli's a little more severe was the amount of swelling in her brain, but as well she had a large amount of bleeding from a large draining vein. The surgery was a couple hours and entailed going in, removing a piece of the skull. Due to the underlying injury in the brain, the swelling, it was deemed necessary to leave the piece of skull off in order to allow room for that brain to expand. When I met Gail in person, it was out in the waiting room. She was talking with the chaplain. She was very, very reasonable, very understanding, but also understandably very emotional. You could tell that she really cared a lot for Karli, and they had a close relationship.
I literally sat there and I shook. I didn't want to believe it, but I knew it was happening and I needed to figure out how to deal with it, but I didn't know how to deal with it, and I just didn't know what this meant for us. I actually truly felt like I was losing her, that there wasn't going to be much hope at all that she would live through this. I remember when Dr. Hawkins came to the waiting area, he was very solemn. he assured me that he did the very best he could, and that we would just need to just wait and see. And it would be essentially, kind of a minute by minute, hour to hour situation for us.
After Karli's accident, honestly, the first week, she couldn't breathe on her own. She couldn't eat. She couldn't respond to normal stimuli that even at our most basic functions, a person who's alive can do. She's so young that you always have hope and optimism, especially with her support system, but she had very severe complications and injuries.
When they took me to see Karli for the first time, I walked in and saw a girl that wasn't my girl. And I just sat down and cried. And I begged God to save her for me. It was the hardest thing I've ever had to see.
So neurostorming is a really scary medical anomaly with brain injuries. Your body is overstimulated. It's in hyperdrive. It's hard to, once it's starting, to counteract that. And that's something that Karli underwent a lot.
It was a very common issue at the beginning of her stage of recovery, to the point that we would want to lighten sedation, but then her brain would overreact and we would have to come back and start sedating her a little bit more, and then retry the next day about waking her up a little bit more each time as we were able to, because every time that we woke her up, if she would neurostorm, it would just put her progress back.
No mom would want to see that with her daughter. And from a nursing standpoint, because we're trying to lower the stimuli, lower the volume and everything in the room, we'd have to have Gail step back and just watch, and that's really hard to do. I can't imagine from her standpoint.
Her face would just become beet red. She would struggle. Her blood pressure would just be sky high. She would sweat profusely. And I was at her bedside so many times when this happened, and there was nothing that I could do other than hold her hand and talk to her and pray.
We tried not to get our hopes up, because I kept on telling Gail, there are good days, there are bad days. But the first couple times she would start tracking around the room and start moving her extremities just a little bit more consistently. That was a big couple days for Karli to be able to do.
We were able to get her up in the chair, get her moving, really start to interact with her as we came down on the medications, and her brain was able to tolerate without overreacting.
There was a wonderful respiratory therapist named Michelle, and she did say one day, we need to get Karli out of this room. And I'll never forget that, and be ever grateful to her, because we did get her up into a chair and took her for actually kind of a little ride around the hospital, and so she could just see some different things, even though she wasn't necessarily that cognizant of everything. But it was good to get her out and give her a little fresh air. So that was encouraging to me, just to do that.
So from there, she would very slowly start to take a few steps forward in her healing process, where it might have just been the thumb first, but then she was able to squeeze a hand, and then she could initiate more movement with all of her other extremities. And then we got to see glimpses of Karli's personality.
And she really just started to show her true colors of the sweet girl that she is.
One of the first times that I walked in to Karli's room, and I kind of said her name, and she was able to look at me and gave me a big old smile, and Gail was ecstatic, and it's like she knew who I was, and it's that kind of that actual response of her recognizing somebody. Those are the things that make you feel really good about her actually being inside and knowing what's going on. When Karli left here and went to acute rehab, she had to learn essentially every part of her basic daily activities again. She couldn't walk, she couldn't eat, she couldn't do anything on her own, so she had to relearn all of those with therapies after she left the hospital.
So while she was at Madonna, she was doing extensive physical therapy as well as occupational therapy. She progressed well there. They did very intense work with her physically. I watched Karli go from not being able to really do much of anything to starting to do the things that normal people would do.
The program and the system worked for Karli in this instance, where we had enough resources there immediately. We had highly trained paramedics and EMTs, and we were en route to the trauma center in just over 10 minutes, and she was provided a high level of pre-hospital care, followed up by excellent care at the trauma center.
Bryan Trauma has been the birthplace of ATLS, and I think we've always had a commitment to excellent trauma care, and I don't think that that's going anywhere. I think that's the cool part of trauma. If you don't function well together, it's not gonna run, it's not gonna turn out in a successful manner.
Karli's recovery continues to be amazing. She was one of the sickest people you can possibly be after an accident, and she is rehabilitating to the place where, miracles can happen with the support system that she has, and like I said, her tenacity.
Today I feel good. I feel grateful, I guess. That's the main word. It's been a long road, and I've emotional days and hard days with just my therapies and stuff, but I didn't come this far for nothing. My doctors, my nurses, the surgeons, they all play a huge role with, everything that they have done and helping me someday soon, go back and meet with these people again and just tell them how much I appreciate everything they have done for me.
Hello! Hi! Thank you so much. Oh, thank you.
Yellow flowers because you're so bright. And you're our miracle patient.
Thank you.
Yes.
I'm glad to see that smile. I kept seeing that smile on 2 North forever and ever and ever. I was in the respiratory, yeah. Oh, okay. Yeah, I kept seeing that smile on. She's there. She's good. She's there. Yeah, she knew. Hi, guys. It's an emotional thing.
It
Got a lot to be proud of.
Yeah.
Very much.
Definitely.
Yeah.
I have some things that I still want to do. I want to go places, and I think that will be more motivation to get to that point where I can do that.
I feel like Karli's future is very bright. She's got a lot of things ahead of her, but she's on a path that will take her to where she wants to be and needs to be. When I walked into the hospital and said, "That's not my girl," and yet it was, but the girl I have now is the girl I knew pre-accident. The very happy girl who just enjoys life, enjoys people, and never stops smiling.